Hello and welcome to Health Mastery. Our today and very important topic is 8 warning signs of thyroid cancer you must not ignore. Stay until the end of the video for the important takeaway tips. Have fun by watching and don't forget to share it with friends, family, and on the social media. I'm particularly happy about a subscription and a like. It's important to note that if you suspect you have thyroid cancer or experience any concerning symptoms, you should consult with a healthcare professional for a proper diagnosis and advice. That being said, here are some potential warning signs associated with thyroid cancer. Our first sign are lump in the neck. A lump in the neck can be a symptom of various conditions, including thyroid cancer. Thyroid cancer often presents as a painless lump or nodule in the thyroid gland located in the front of the neck. However, not all neck lumps are cancerous, and many are benign. It's important to note that these symptoms can also be caused by various non-cancerous conditions. Additionally, thyroid cancer may not always present with noticeable symptoms in its early stages. Our second sign are changes in voice. Respiratory infections affecting the respiratory system, such as laryngitis or bronchitis, can lead to hoarseness or changes in voice. Gastroesophageal reflux disease, GERD, stomach acid flowing back into the esophagus can cause irritation and affect the vocal cords, leading to changes in voice. Thyroid issues, both hypo and hyperthyroidism can cause voice changes. Thyroid disorders can affect the function of the vocal cords and lead to hoarseness. Neurological conditions affecting the nerves controlling the vocal cords, such as Parkinson's disease or stroke, can result in changes in voice. Vocal cord nodules or polyps, non-cancerous growths on the vocal cords can cause hoarseness and changes in voice quality. Smoking and irritants. Smoking or exposure to irritants can damage the vocal cords and contribute to voice changes. Our third sign are difficulty swallowing. Difficulty swallowing, also known as dysphagia, can be a concerning symptom that should not be ignored. It can be associated with various medical conditions, and seeking prompt medical attention is important for proper diagnosis and treatment. Esophageal stricture, narrowing of the esophagus due to scar tissue or other factors, can make it challenging to swallow. Our fourth sign are persistent cough. A persistent cough is a symptom that should not be ignored, as it can be associated with various underlying health conditions. While many causes of coughing are benign and may resolve on their own, it's essential to pay attention to a cough that persists for more than a few weeks. Respiratory infections, viral or bacterial infections such as the common cold, flu, or bronchitis, can lead to a persistent cough. Allergies. Allergic reactions to airborne irritants such as pollen, dust, or pet dander can cause a chronic cough. Asthma. Chronic inflammation of the airways in asthma can result in coughing. Postnasal drip. Excess mucus dripping down the back of the throat can cause irritation and a persistent cough. Chronic bronchitis. Long-term inflammation of the bronchial tubes can lead to a chronic cough, often associated with smoking. Environmental factors, exposure to irritants such as smoke, pollution, or occupational dust can contribute to persistent coughing. Our fifth sign are neck and throat pain. Neck and throat pain can be indicative of various underlying health issues, and it's essential not to ignore persistent or severe discomfort. Muscle strain. Poor posture, overuse of neck muscles, or sleeping in an awkward position can cause muscle strain, leading to neck pain. Viral infections. Infections such as the common cold or flu can cause throat pain and discomfort. Bacterial infections. Strep throat, tonsillitis, or other bacterial infections can lead to throat pain and may require antibiotic treatment. Laryngitis. Inflammation of the larynx, voice box, can cause hoarseness, throat pain, and difficulty speaking. Thyroid disorders. Conditions such as thyroiditis or an enlarged thyroid gland, goiter, can cause neck discomfort. Injuries. Trauma or injuries to the neck, such as whiplash, can result in pain and stiffness. Our sixth sign are swollen lymph nodes. Infections. Swollen lymph nodes are often a response to infections such as colds, flu, or other respiratory infections. They can also be associated with infections in other parts of the body, like the throat or skin. Bacterial infections. Bacterial infections like strep throat or cellulitis can cause swollen lymph nodes. In some cases, these infections may require antibiotic treatment. Viral infections. Viral infections such as mononucleosis, mono, or HIV can lead to enlarged lymph nodes. Inflammatory conditions. Autoimmune disorders like rheumatoid arthritis or lupus can cause inflammation, and result in swollen lymph nodes. Cancers. Swollen lymph nodes can be a symptom of certain cancers, including lymphoma, leukemia, or metastatic cancer. Our seventh sign are changes in appetite or weight. The unintended weight loss. Sign of underlying conditions. Unexplained weight loss could be a symptom of various health conditions, including digestive disorders, hyperthyroidism, diabetes, or cancer. Nutritional deficiencies. Inadequate nutrient intake or malabsorption issues can lead to weight loss and may indicate underlying problems. The unintended weight gain. Hormonal imbalances. Conditions like hypothyroidism, polycystic ovary syndrome, PCOS, or Cushing's syndrome can contribute to weight gain. Metabolic disorders. Some metabolic disorders may result in weight gain, such as insulin resistance or metabolic syndrome. Digestive issues. Gastrointestinal problems, such as inflammatory bowel disease or peptic ulcers, can affect appetite. Psychological factors. Stress, anxiety, depression, or eating disorders can impact appetite and eating habits. Changes in weight. Both unexplained weight loss in type 1 diabetes and weight gain in type 2 diabetes can be associated with diabetes. Our eighth and last sign are fatigue and weakness. The anemia. Iron deficiency anemia. A common cause of fatigue, especially in women, is a lack of iron in the body. Vitamin deficiencies. Deficiencies in vitamins like B12 or folate can also lead to anemia and fatigue. Thyroid disorders. Hypothyroidism and underactive thyroid can cause fatigue, weakness, and weight gain. Hyperthyroidism, an overactive thyroid, can lead to fatigue, weakness, and weight loss. Sleep disorders. Sleep apnea. Interrupted sleep due to breathing issues can result in chronic fatigue. Insomnia. Difficulty falling or staying asleep can contribute to ongoing tiredness. Chronic infections. Conditions such as mononucleosis, HIV, or hepatitis can cause prolonged fatigue. It's important to emphasize that these symptoms can also be caused by conditions unrelated to cancer. If you experience any of these signs or have concerns about your health, it's crucial to consult with a healthcare professional for a thorough evaluation. They can perform appropriate tests, such as imaging studies and biopsies, to determine the cause of your symptoms. Regular checkups and screenings are also essential for early detection and better outcomes. I hope I could help you a little with these very helpful tips, and I'm looking forward to a new exciting video. See you soon, and stay healthy. Your Health Mastery Team.